Hello, this is Xiaolong Bai and Zixin Huang from group99. We're going to present our WOW project about diabetes prediction. Next slide, please. This is our table of contents. First, I'm going to introduce the dataset we used for our prediction model. The diabetes prediction dataset is a collection of medical and demographic data from patients, along with their diabetes status, which is a target variable. The data includes features such as age, gender, BMI, hypertension, and so on. 8 features in total. We use this dataset to build machine learning models to predict diabetes in patients based on their medical history and demographic information. Next slide, please. For the application expectation, the model we built can be useful for healthcare professionals in identifying the patients who may be at risk of developing diabetes and in developing personalized treatment plans. Additionally, the dataset can be used by researchers to explore the relationships between various medical and demographic factors and the likelihood of developing diabetes. Next slide, please. The first step we deal with this data is EDA. First, we check the missing value. We found no missing value for all records. Then, checking duplicate value, eventually dropping all duplicates. Next, we have done the univariate analysis. We check every single feature, get descriptive statistics of them, visualize their distribution, finally finding special patterns of them. For example, there are few records having other value for the gender feature. This may impact the performance of some machine learning algorithm. Therefore, it could be treated as either female or male value. For column age, the range of values are from 25 to 60. Therefore, we will normalize this for building the machine learning models. We also find imbalance in features like the hypertension or heart disease. Next slide, please. Then we draw a correlation matrix, finding that diabetes feature has positive correlation with 6 features like age, glucose level, whereas for the others, target has very low correlation with them. Further conducting the bivariate analysis, pairing each feature with a target variable, exploring some potential connections. Next slide, please. Based on the above EDA, we need to do some further process before we conduct classification models. As mentioned before, the values of gender and smoking history will be converted to binary values by one-hot encoding method. Next slide, please. And we also use SMOT to make balance of this dataset, then scaling the SMOT dataset. Next slide, please. And finally, the final step is to run RFE to select important features. We decide to select the top 4 features to improve the model robustness. The top 4 features are age, BMI, HbA1c level, and blood glucose level. And next, I'm gonna pass to the classification horse race.
Further, we implement a classifier horse race employing methods from logistic regression decision tree naive Bayes, KN to LightGBM. We calculate the performance metrics including average accuracy, balanced accuracy, and AUC. From the results, it is evident that the XGBoost stands out with relatively high balanced accuracy and AUC, making it the winning algorithm. Consequently, we select XGBoost for further hyperparameter tuning using GridSearch, which automates the optimization process. During this process, we test smaller depths, increasing step size, and limited number of parameters to expedite execution. Using the optimized XG model, we predict on-test data and assess the model's performance through accuracy, AUC, confusion metrics, and recall rate. We employ a visual tool, the cumulative gain curve, to demonstrate predictive value. Notably, the plot for class 1 exhibit a steep curve, indicating that targeting the 20% of the case can capture a large proportion of actual class 1 cases. The approach is particularly useful in scenarios with limited resources for follow-up. Additionally, we explore adjustment based on the delta from balancing and cost sensitivity to enhance model performance on imbalanced data. From delta from balancing, we adjust the default 0.5 prediction threshold to 0.5 plus delta, improving sensitivity to the minority class and achieving better balance accuracy and AUC. For delta from cost sensitivity, we examine the change in performance metrics after implementing cost sensitivity learning, which prioritize minimizing a cost-weighted sum of misclassification. After applying these methods across various models from perceptron to LightGBM, we determined that the LightGBM performs well in terms of balanced accuracy and overall accuracy. We then analyze the LightGBM's learning curve. The model is performing well with its current setup, especially in managing the trade-off between bias and variance. The increase in training MSE with more data suggests that the model is less overfit to the training data, which is a positive sign of its ability to perform well on unseen data. Further improvement can be likely come from refining the model, exploring additional data features, and applying more sophisticated machine learning techniques or ensemble methods. Thank you. This is all for our presentation.